Dr. Lundberg, thank you so much for joining us. I know the work that you're doing with the Karolinska University Hospital, it means so much to us. And having started it 30 years ago and being honored tonight, I'd love to ask you, what are the biggest changes you have seen for the myositis community when it comes to research and treatment?
Thank you for inviting me and for awarding me with this very prestigious award. As our team, we are of course very proud and very honored. And over the 30 years, we have really seen a remarkable change in the care and the management of patients with myositis. What we have contributed with from our team, one of the major change, I think, of treatment is to introduce exercise. And I've done this in close collaboration with my colleague, Helena Alexandersson, who is a physiotherapist, and we started about 30 years ago to introduce exercise through research programs. And now it has been established as one of the important part of the treatment for patients with myositis in combination with immunosuppressive therapy.
I deem myself to be very lucky. It took about 2 months for me to be diagnosed, but I know that that is not the case for the majority of people. When we're talking about diagnostic criteria and how people are being diagnosed with the different forms of myositis, where do you see the changes that need to be made, and what can we be excited about for the future?
Well, there are different levels of how long time it takes for the diagnosis. One is the sort of the patient's delay. We have to raise the awareness of the disease in society so people can come to the doctors earlier than today. And then doctors need to be aware of the disease and the different phenotypes of myositis, because today myositis is not only a muscle disease that we were trained like at medical school. We see it as a complex systemic inflammatory disease with multi-organ involvement, and the first symptom can be in the joints, it can be in the lungs, skin or muscle. But primary care physicians need to be aware of these different aspects, and I think also we can use internet so that if you have symptoms you can find them, and we can guide people on the internet, maybe through TMA, so that when you have symptoms you can at least discuss with your doctors if this could be myositis.
It's one of the things I'm hearing a lot of patients say is, I wish my doctor had known more about dermatomyositis or inclusion body myositis. And I think for us as the patients, it really comes down to us having to advocate for ourselves, but share our stories, because it's not just everyday people listening, it's also physicians.
Yeah.
And I'm wondering what sort of advice you would give to patients about self-advocacy and standing up for themselves and learning to be vocal about something that is very personal.
Yes, that's a difficult question. But I think through organizations, you can both tell your stories and be part of patient research groups, research partners, that at least in Europe we have those organizations, both that you are trained to discuss with scientists, but also that you come into a network where you can share your stories, and then you can learn how to tell the stories, and it can be spread outside the myositis network, because we really need to reach outside to raise the awareness.
The last thing I want to ask you, with the work that you're doing at the Karolinska University Hospital, what are you most excited about moving forward?
What we have learned over these 30 years is that myositis is such a complex disease. We have to identify the pathways, the molecular pathways in the different subgroups, and maybe down on individual levels. We're talking about personalized medicine. And I think that's, if we aim for more personalized treatment based on research. I think that could be a way to improve treatment. We find the right treatment to the right individual from the beginning, and that will, I think it will improve the effect of treatment and will reduce the duration where you have lots of symptoms and reduce the risk of damage. So I think that learning more about the disease mechanism on a quite molecular level, and then we can target therapies, and we need to develop new therapies to the targets we find.
Well, thank you so much for being here, Dr. Lundberg, and for the work you're doing. And as somebody who is new to the myositis community, it means so much to me, and I'm so excited to see how hopeful you are. So thank you.
Thank you so much. Thank you.